Hello, my name is Christine Hamori, and I'd like to introduce my colleagues, Dr. Bruce Van Natta and Dr. Ashley Gordon. And today we're going to talk about a very controversial issue of breast implant illness. What do we know about this topic, guys?
Not very much. Fortunately, the society, as you know, is doing active research in this now, really trying to figure out, are there lab tests that we can do to figure out who are genetically susceptible patients that might have issues with implants, but we just don't have that data yet.
Yeah, and clearly this is in social media. Patients are coming in asking about this, right? And is this real? And I imagine we've probably had some patients that were going to have breast augmentation that maybe aren't even making the appointments now.
Right, they hear about it.
Out of fear, right? So, you know, obviously we have to talk about it to our patients. Our patients are asking questions like, is this real? And that's a difficult one to answer, honestly. I tell patients that we think there is a possibility that there may be a small percentage of patients that something's going on. Where I'm actually sponsoring some research through the Aesthetic Society Research Foundation on looking at bacteria. It seems like the bugs are always the problem in breast implants, right? Bacteria interacting with the fat cells in the breast that produces this compound that gives immune-like symptoms. So that's a long way, though, from what the patients are seeing on the website, which says those implants are toxic, they're, you know, emitting these chemicals, and I'm interested to see what you guys think, but I think there's a lot of misinformation out there.
Oh, absolutely.
Right?
And I think, you know, the symptoms are vague and systemic, and I think those symptoms can also be attributed to vitamin D deficiency, hypothyroidism, menopause, just being a mom and having young kids, you know, brain fog, fatigue, exhaustion, some
right.
joint pain.
Yeah.
It's a very strange constellation of symptoms, and I think a lot of times these patients don't want to be worked up because they're convinced because of social media that it is their implants. And unfortunately, I think they seek out doctors that don't work them up, just want to take their implants out, do this en-bloc capsulectomy, leave them deformed, and it's just really tragic.
Well, and let's face it, it's frustrating. You know, I mean, you've got these symptoms, you want an answer. You want to know, why am I having this? And when someone suggests, you know, and they go to that Facebook page and down the rabbit hole, and they suggest that, yeah, it's those implants, they're toxic, you got to get them out.
I like to tell my new patients that are coming in, because I feel like you have to explain, there's two things that you'll hear about in the news is BII, and you're going to hear about ALCL. One we know a lot about, the other we don't know a whole lot about.
That's true.
And you just have to understand, once we have the consultation, you start telling your friends or your parents or anyone you're having this done, they're going to bring up BII, and they're going to mention it, so they have to like know ahead of time how to defend it. Well, thanks for joining me, and if you have any other questions, you can contact the Plastic Surgery Channel at plasticsurgerychannel.com.